Imagine it's early in the morning, and the aroma of freshly ground coffee fills your kitchen. You pour yourself a cup, take that first comforting sip, and feel a slight jolt of energy coursing through your veins. It's a ritual shared by millions of people around the world, helping us start the day with a bit more clarity and motivation. But if you're a man who has ever worried about prostate health, you might have wondered, does my morning cup of coffee help or harm my body, specifically my prostate? As a urologist with over 35 years of clinical practice, I've seen countless patients walk through my door, many of them concerned about what they eat or drink and how these habits might affect their prostate. Of all the beverages we've discussed, coffee is by far the most common. Some fear it might worsen urinary symptoms or contribute to the development of prostate issues like benign prostatic hyperplasia, BPH, or even prostate cancer. Others are convinced that coffee could protect them, citing studies on antioxidants and anti-inflammatory compounds. There's a lot of confusion, which is understandable. Coffee is a complex beverage containing over 1,000 chemical components. Some seem beneficial, while others may cause problems if used inappropriately for certain health issues. If you've ever wanted a simple explanation to help you decide whether to keep drinking that cup or perhaps switch to decaf, you're in the right place. In this article, I'll explain what scientific research tells us about coffee and the prostate. We'll explore the potential benefits, the potential drawbacks, and how to enjoy coffee responsibly without compromising your well-being. The world's love affair with coffee. Before diving into the science of how coffee can affect the prostate, let's examine why coffee is such a popular beverage worldwide. From bustling cafes in Paris to convivial breakfasts in America, coffee is a unifying force, a drink that transcends cultural boundaries. In many countries, it's not just about caffeine. It's also a cherished social ritual. We meet friends for coffee or enjoy a quiet moment alone before a busy day. But for men concerned about prostate health, these daily habits can raise doubts. Does coffee worsen my symptoms? Should I cut back to avoid potential problems? These thoughts often linger. Fortunately, science has been studying these questions for years and offers useful information to help separate fact from fiction. Why the prostate is important. The prostate may not be the largest organ in the body, but it plays a huge role in men's health. This small, walnut-shaped gland is located just below the bladder and surrounds the urethra, the tube through which urine leaves the body. Over time, the prostate can become enlarged, a condition known as BPH, inflamed, prostatitis, or develop cancer. Symptoms often include difficulty urinating, increased frequency and urgency, or pain in the pelvic region. Given that prostate problems can seriously affect a man's quality of life, anything that influences this gland, for better or worse, deserves careful consideration. Let's see how coffee fits into the picture. The complex chemistry of coffee. If you've ever felt a jolt after drinking coffee, you're already familiar with caffeine. But coffee is much more than just a dose of caffeine. In fact, each cup contains over 1,000 different compounds, including antioxidants and polyphenol. Researchers have been eager to discover how these chemicals interact with the human body. Antioxidants. These substances help fight oxidative stress, a process in which unstable molecules called free radicals can damage cells. Chronic oxidative stress is involved in various diseases, including lung and prostate cancer. Antioxidants in coffee, such as chlorogenic acid, can help limit this type of cell damage. Polyphenol. These are plant-derived compounds with potential anti-inflammatory and anti-cancer properties. They can influence insulin sensitivity and metabolic and inflammatory health in the body. Chronic inflammation is a known risk factor for many diseases, including certain prostate conditions, so compounds that reduce inflammation may have a protective effect. Caffeine. The most famous ingredient in coffee, caffeine stimulates the central nervous system, keeping us alert and improving our mood. However, as we'll see, caffeine can also have less desirable effects on certain organs, such as the bladder and prostate, especially when consumed in large amounts. Scientific perspective. Potential benefits. Possible reduction in advanced prostate cancer risk. One of the most encouraging findings in scientific literature is that moderate coffee consumption may slightly reduce the risk of advanced or aggressive prostate cancer. A study published in the journal Cancer Causes and Control revealed that men who drink 1 to 3 cups of coffee per day showed a lower incidence of aggressive prostate tumors. Researchers suspect this could be linked to the antioxidant and anti-inflammatory compounds in the beverage. Anti-inflammatory effect. Inflammation of the prostate can exacerbate problems such as chronic prostatitis or accelerate the progression of BPH. Given that coffee contains compounds that can mitigate inflammatory pathways, it could offer some degree of protection. However, these effects seem to be more beneficial at moderate consumption levels. Supporting metabolic health. An interesting aspect of coffee is its relationship with metabolic diseases like type 2 diabetes. Many studies show that moderate coffee consumption can reduce the risk of developing type 2 diabetes. In turn, diabetes is associated with a higher likelihood of suffering from prostate issues, including BPH. By helping to control metabolic health, coffee could indirectly support prostate health. The other side of the coin, potential risks and drawbacks. While research highlights some benefits, coffee can also have downsides, especially for men who already suffer from prostate problems. This is where moderation becomes crucial. Irritation and inflammation. Caffeine is a stimulant and a natural diuretic, which stimulates the kidneys to produce more urine. This can be a problem for men suffering from BPH or overactive bladder. You might notice more frequent urges to use the bathroom or a weaker stream if you already have urinary symptoms. Additionally, excessive coffee consumption can irritate the bladder and prostate, increasing discomfort in men with chronic prostatitis. Excessive caffeine, too much of a good thing, can quickly turn bad. Drinking more than 400 milligrams of caffeine per day, about 4 to 5 cups of regular coffee, can overload your system. In some men, this can cause symptoms such as nervousness, insomnia, or digestive problems. When the urinary tract is already under stress due to BPH or prostatitis, excessive caffeine can exacerbate or intensify symptoms. Impact on sleep. Sleep is the cornerstone of overall health and directly influences the proper functioning of our immune system. Poor sleep can exacerbate chronic inflammation, which could indirectly affect prostate health. If you drink coffee in the late afternoon or evening, you risk disrupting your sleep cycle, which could lead to increased inflammation, irritability, or fatigue. Variation in impact. Why it differs from person to person. It's important to note that the effect of coffee on the prostate is not the same for everyone. Several factors can influence how coffee interacts with your body. Genetics. Some people are genetically predisposed to metabolize caffeine slowly. This slower breakdown can increase the negative effects on the urinary system. Genetics also influence the risk of suffering from a prostate disease, making the impact of coffee more pronounced in some men. General diet. If you regularly consume spicy foods, alcohol, or very fatty or processed products, your bladder may already be irritated. Adding coffee to the mix can be the perfect recipe for worsening symptoms. Frequency and timing. Drinking coffee on an empty stomach can cause heartburn or acid reflux in some people, which can also worsen urinary discomfort. Pre-existing conditions. If you suffer from chronic prostatitis, overactive bladder, or advanced BPH, even a moderate amount of coffee can exacerbate your symptoms. Recognizing symptoms of excessive coffee consumption. For men who already have urinary problems, here are some signs that your coffee drinking habits might be contributing to your discomfort. Frequent urination. The need to urinate several times during the day and night can be bothersome. While frequent urination is common as men age, the diuretic effect of coffee can exacerbate the problem. Urinary urgency. This sudden and strong need to find a bathroom can become more pronounced with high caffeine consumption. Weaker stream. BPH already narrows the urethra, making urination slower. The irritating effects of coffee can worsen the problem. Pelvic discomfort. Chronic irritation can increase any underlying pelvic pain. If you notice these symptoms worsening when you drink coffee, it might be time to adjust your habits. Drinking coffee responsibly. Practical tips. Quitting coffee altogether can be difficult, especially if it's part of your morning or social routine. The good news is that you don't have to quit completely. Here are some strategies to keep your prostate healthy while enjoying your favorite beverage. Moderate your consumption. Try to drink 1 or 2 cups a day. If you crave a hot beverage in the late afternoon, consider switching to herbal teas or low-caffeine drinks. Try decaf. Decaffeinated coffee still contains many beneficial antioxidants, but with much less caffeine. If you enjoy the taste of coffee but want to reduce the stimulant impact, decaf can be an excellent compromise. Combine coffee with food. Consuming coffee with a meal or snack helps mitigate its effects on the stomach and bladder. This can reduce acidity and decrease irritation. Pay attention to temperature. Extremely hot liquids can irritate your mouth, throat, and potentially the urinary tract. Let the coffee cool slightly before drinking. Stay hydrated. The diuretic properties of coffee can cause you to lose fluids more quickly. Combat potential dehydration by drinking enough water throughout the day. Monitor the time. Try not to drink coffee in the late afternoon or evening, as it can disrupt your sleep. Compromised sleep can exacerbate inflammation and stress. Natural remedies and lifestyle habits for a healthier prostate. Coffee is just one piece of the puzzle. If you want to optimize your prostate health, or at least minimize risks, consider incorporating other natural remedies and healthy habits into your daily routine. Supplements and natural foods. Saw palmetto. Often used for BPH, saw palmetto can help relieve urinary symptoms by reducing prostate inflammation. Pumpkin seeds. Rich in zinc and antioxidants, pumpkin seeds have long been touted for their potential to support prostate function. Green tea. This tea is packed with catechins, powerful antioxidants believed to protect cells from damage and reduce inflammation. Turmeric. Curcumin, the main active compound in turmeric, has well-documented anti-inflammatory properties. General health habits. Balanced diet. Prioritize a variety of fruits, vegetables, whole grains, and lean proteins. Limit processed foods and sugary snacks, which can increase inflammation and exacerbate prostate problems. Regular exercise. Staying active helps maintain a healthy weight and promotes cardiovascular health, which has been linked to better outcomes for men with prostate issues. Limit alcohol and tobacco. Excessive consumption of alcohol and tobacco can increase inflammation and the risk of several types of cancer, including those affecting the prostate. Regular checkups. Starting at age 50 or earlier if you have a family history of prostate problems, schedule regular prostate exams and discuss screening options with your healthcare provider. A small anecdote from my practice. To illustrate how these guidelines can work in real life, I'd like to share a brief anecdote with names and details changed for confidentiality reasons. One of my patients, let's call him Robert, was a 58-year-old office worker who drank coffee all day. He came to see me complaining of frequent urination and mild pelvic pain. After a thorough evaluation, we discovered that Robert had early-stage BPH. One of our first steps was to adjust his caffeine consumption. Instead of drinking 5 to 6 cups of coffee a day, we advised him to limit himself to 1 cup in the morning and switch to decaf or herbal teas in the afternoon. We also suggested he drink more water, cut back on late-night snacks, and add moderate exercise to his routine. Within a few weeks, Robert reported fewer bathroom trips and increased overall comfort. By simply changing his coffee habits and making a few lifestyle adjustments, he experienced noticeable relief without having to give up his beloved morning cup of coffee. In conclusion, coffee can have varying effects on the prostate, but with moderate and responsible consumption, it is possible to enjoy this beverage while maintaining good prostate health.